Hello, everyone. Good morning, good afternoon, wherever you're calling in from. I hope my audio is clear. My name is Cindy Sego. I am the program coordinator for the National American Indian Alaska Native Prevention Technology Transfer Center. And welcome to our monthly listening sessions. So for today, our listening sessions are going to be a little different from what we usually have. Usually we would have a presenter come in and share about the work that they're doing in their community and resources that have helped them so far. And, you know, the usual peer-to-peer sharing. Today we will have the peer-to-peer resource sharing, but we're not going to have like a dedicated presenter. All of us, I hope, are going to be presenting. This session, we're looking at it being the last for this year because the next sessions will be falling into holiday times, and we know that we're not able to host sessions at those times. And so, you know, we're hoping that this session would have all of us share about how these listening sessions have been helpful so far. And so, as usual, we'll like to start in a good way. We have our co-director from our center, Sean Bear, on the call. Hi, Sean. Sean has offered to honor us with an opening blessing. Thank you, Sean.
Thank you, Cindy. Hope you can hear me okay. Thank you.
Thank you so much, Sean. Thank you for blessing us with that opening blessing. And so just before we start, I would like to welcome everyone again. For those who just joined after we made the introduction, today's session is going to be a little different. Being the last for the year, we'll look to hearing from everyone, sharing resources and how these sessions have been beneficial to them. And so just a little brief introduction about our center. Our center, the National American Indian Alaska Native PTTC, is funded by SAMHSA, and we're part of the PTTC network. We have 10 regional centers all over the nation. Our national coordinating office is in Kansas City, and we also have a sister center, the National Hispanic and Latino PTTC, that supports the Latinx population. And yes, and like I mentioned, we are supported by SAMHSA, and although this is a project supported by SAMHSA, whatever is shared here does not necessarily reflect the views and policies of SAMHSA, HHS, or the American Indian Alaska Native PTTC. And after today's session, if there are any resources that are shared, we would also forward that to you. There will also be a follow-up email with ways to request and receive CEUs for this session, and also a link to our evaluation survey, the GIPRA. We'll also put the GIPRA in the chat box so you can fill it out before you go. However, it will also be in the follow-up email if you missed that. And although we are gathered here virtually, we would like to take some time to acknowledge the land that we all live on, and pay respect to the indigenous nations whose homelands were forcefully taken over and inhabited. Past and present, we want to honor the land itself and the people who have stewarded it throughout the generations. This calls to us to commit to forever learn how to be better stewards of these lands through our action, advocacy, support, and education. We acknowledge the painful history of genocide and forced occupation of Native American territories, and we respect the many diverse indigenous people connected to this land on which we gather from time immemorial. While injustices are still being committed against indigenous people on Turtle Island, today we say thank you to those that stand with indigenous peoples and knowledge that land reparations must be made to allow healing for our indigenous peoples and to Mother Earth itself. And this land acknowledgement was put together by 3 members of our team, Ella and Keely Driscoll, who are sisters, and our co-director, Sean Bear, who just honored us with an opening blessing. And so to start our session, we started our session in a good way. Like I mentioned today, we are going to do it a little differently, asking about, how the past year has been for you with the resources that have been shared and the presenters that have come on this call. And so the first question I have, and I hope it leads us to other questions, are why did you initially register for this series, or why did you join in today? And what topic have we covered in the past year, or more than the past year, because we started this at the beginning of the pandemic, and it's been about 19, 20 months. What topics have we covered have been most relevant to your community? And if you have any resources to share while talking about that, we'd love to know how to connect with those. And so, yes, that is the first question. I'm wondering if there's anyone. You could use the chat box to share. You could also raise your hand and have your audio to share. Thank you. And maybe before anyone else starts, I would also start. Although I'm one of those who have been working to have these sessions made available, I'll say one of the topics that really resonated with me and the work that I do is a topic we had on strategies for supporting substance abuse and those in recovery during the pandemic, how to use telehealth and resources to help reach out to them while in isolation or while we were in lockdown, if I would say. And that was very helpful for me, with the work that I do, helping to provide TA to those on the field and the work that they do, because I had those resources at my fingertips and I could just share them with them. We also prepared the resource guide, which we have on our website. And if anyone is interested, we'll send the most updated copy. Thank you. That was from me. I see we have some in the chat box. Elizabeth says, as a prevention coordinator, this training has been helpful for them as they work in prevention in their tribal community, incorporating culture in the prevention work with youth. Thank you, Elizabeth. Jean says they needed information and exposure when serving Native communities. Sorry, my chat box just kind of closed. They needed information and exposure when serving Native communities. They wanted something they could apply to their outreach for wellness for adults and women of childbearing age to deal with substance use. Thank you, Jane. I hope that was very helpful. Takesha says, oh yeah, she was having trouble, but she's here. Okay, thank you. Sheila says motivational interviewing. Thank you. Thanks for joining us, Leah. Leah joined because you're looking forward to learning from everyone. Thank you. Anyone want to share by taking down their mic?
I can share. Hi, everyone. My name is Marlinda. Nice to meet everyone. Again, my name is Marlinda Hodley, and I am the Tribal Community Specialist for AZ Health Zone here in Arizona. And our program is a SNAP-Ed program for our state. So I just want to learn more about, how can I help our local agencies work with tribes? What are some resources? And our program specifically focuses on nutrition and physical activity. So just learning more to have, just resources on prevention and just working with the tribe specifically, because we do work with youth, adults, and elders as well. So happy to be here. Thank you.
Thank you, Melinda. Anyone else?
Hello, this is Diane from Yankton, South Dakota. Do you hear me?
Yes, Diane, we can hear you.
I appreciated attending these and learning with everyone. I was able to collaborate and work with one of the speakers to bring a topic to a youth and family Indigenous summer program that we did about missing, murdered Indigenous women and relatives, and using this. And it was through this that we actually met, realized we were in the same region, and we're able to collaborate together on other things and in the future. So thank you for having this and allowing us to come to this. Thank you.
Thank you, Diane. Anybody else like to share? In the meantime, I see some in the chat box. Yeah. Yes. So Tana says, because of COVID and the Wind River Reservation being shut down, it was difficult to work with and connect with provincial partners that they had such good relationships with. The working landscape has changed, and we're having to change the way we do things. And their hope is for being present today is to gain ideas for moving forward with programs and projects. Thank you. Naomi says that they would love more trainings and information. And so that, could lead us to our next question, and which is, what topics would you like additional trainings for in the future from our center? We offer technical assistance and trainings at no cost to your organization or your community. And so let us know what trainings and other topics you'd like us to cover. You could put that in the chat box and also take down your audio too. Thank you. Someone says they provide TA support to tribal communities in Kansas and currently supporting their efforts for opioid and stimulant and youth marijuana use prevention. Understanding culture as prevention is what has helped them the most. Thank you for sharing that. And Ben, yes, Ben is one of our very consistent audience members. And Ben says, let me read here. Ben joined today because they feel learning is a lifelong process and they feel they learn something every time they get on these webinars. Ben works with public schools and with all kinds, and they feel this training has helped them understand all cultures and the programs that they do. Yeah, sorry, my chat box keeps closing. And plus you can pick something up from each training to share with family and friends to go out and be better people of our communities. Teach treating others as we want to be treated. Thank you, Ben. All right. Let's see. Okay, so Sheila says they would like training in alcohol and meth use disorder. Okay, thank you, Sheila. We'll have that noted down and look at providing more trainings in that area. Twice, I'm not sure if I pronounced that right. They're planning a trauma-informed care conference as long as the pandemic is not around, fingers crossed, and we'd love to network. Okay. All right, thank you, Atwai. So please send us an email. I'll put my email in the chat box and you can let us know more about your conference. And if others are interested, they would also probably register, but we'd love to work with you on that. Ben says, topics on prevention, native ways of teaching this through storytelling. Ben is a prevention specialist and has valued and appreciated our information. Thank you, Ben. Right, so prevention through storytelling. Naomi is asking if we offer trainings to get certified as prevention specialists. Yes, we have trainings. We have the SAPS training, and that covers the topics to get certified as a prevention specialist. And so please send us an email about the specifics of the trainings. And yes, we do offer those trainings that would help with certification. Anyone else want to take down their audio to respond? Thank you. I do know Ben has already shared, but you know, I'm wondering if he has more he would like to share. I put you on the spot, Ben.
You say Ben?
Yes.
Did you? I'm sorry, I misunderstood. What did you ask about sharing?
I know that you'd shared in the chat box, but I was wondering if you'd elaborate more about, you know, the native ways of teaching through storytelling or some other training you'd be interested in.
So I've sat in on quite a few of these, and each time I feel like I learned something new on and on the ones especially when they're shared stories of sweat lodges and the support of it. And personally, I've never been to a sweat lodge. I live in the Upper Peninsula of Michigan, where we have a big Finnish settlement, and saunas are a big deal. And a lot of them in our area a lot of people have saunas, and that's about as close as it gets. And I know that's nothing to what it is. So from what I've heard, and I feel extremely privileged, grateful, and thankful to be able to hear the stories of how they've healed. So I do a lot with the kids, and I teach prevention with the kids. And one of the things that I try to do to them to explain things is to teach them to have an open mind in all of what we're doing. And also, I look forward to hearing the stories myself that a lot of these people have gotten healing from. So I hope that helps answer your question, Cindy. But for the most part, I feel like I learn, even if it's something small, I learn something new each time I'm on one of these, and I'm just grateful for that. So, thank you.
Thank you, Ben. Thank you for sharing.
You're welcome.
It's interesting. Okay, Darren wants to also share, so I'll let Darren share before I go on. Yeah. Thank you for sharing, Ben.
I'm going to take a healthy risk and try to share a story. That's okay. It just came to my mind right now. I'm not a very good storyteller, but I got a friend, John Soap. He's from Oklahoma. He's a therapist for the Shawnee tribe. He's a Sac-and-Fox, Shawnee, and Cherokee. We went to Indian boarding school together years ago, but we've always stayed in touch. So we have that same narrative of how we grew up, around boarding schools, and I was a part of the relocation program indirectly. So, but he told me this story about maybe you guys can utilize this, and it comes from the Choctaw people, and it's a poison ivy story, and I like to tell this story because you have that stigma about your mental health. So this is a very good story, I think. When poison ivy was first created, that if you touched the leaf of the poison ivy, they would die. You would die from touching the leaf. People would die. So poison ivy was crying out in the woods, and Black Widow came along and said, "What's wrong, poison ivy?" He goes, "Well, I'm sad because when people touch me, they die." He goes, "Oh, well, why don't you give me some of your poison? Give me some of your burden, and I'll take that with me." So poison ivy gave some of the poison to Black Widow, and it helped a little bit, but people were still dying. So Scorpion came along, and Scorpion said the same thing. Poison ivy's crying. He goes, "What's wrong, poison ivy?" He goes, "Well, when people touch me, they die." He goes, "Well, why don't you give me some of that poison? I'll take some of your burden from you." And poison ivy did, and it helped a little bit, but it didn't really, people still died. So Rattlesnake came along, and he was watching this whole thing. He said, "Poison ivy, give me abundance of your poison, and I'll carry that burden for you." So poison ivy gave Rattlesnake that poison, and it helped. So now if you touch poison ivy, all you get is a little rash. So the Choctaw story is don't carry that burden with you. If you can talk to somebody, if you can talk to your uncle or your relative or your friends, pass that burden. Don't carry it by yourself. Even if you have to go see a therapist, it's okay to go to a therapist and give them that burden that you're carrying. And that's the Choctaw story.
Oh, good one.
That's a good one. Thank you, Darren. That's such an important lesson for all of us, even for those of us that work on the field. We get to carry a lot of burdens ourselves and take time to take care of ourselves, self-care, and share that burden with others who are willing to help. So thank you. That's a beautiful one. Thank you for sharing that. Anyone else like to share? Well, before anyone else has would like to share, maybe I'll just follow up from Ben and Diane, and I think Melinda also had talked about implementing, how this had helped them with some of the work they were doing in their communities and as teachers, and being able to connect and implement. I was wondering if you could share with us, if others could share how they've been able to implement any of these trainings, or what trainings have inspired you to do something different in the work that you're doing. What was that success story, or what was the challenge that you faced that you think we could help with? Thank you. Okay, just to repeat again, just in case. Okay, sure, Ben. Yes, please. Thank you.
So my first year of getting one of these trainings, I took some things that were said on one of the trainings, that was just encourage kids to talk a little bit more. And I had a girl that opened up after one of my classes that said she'd never said anything to anyone, but it kind of ties in with what you're, with that awesome story that was just told by Darren. She was carrying around this heavy burden her dad was using a lot, and she was worried he was going to die. And then about a month later, he passed. And she said she wasn't gonna go talk to anyone. And she was a sixth grader, so I tried my best to encourage her to talk to the school counselor at the time, and she wouldn't do it for about a month after. I asked her, "Have you talked to him yet? Have you talked to him yet? I really think it'd be in your best interest, and it would be helpful to you." And finally, the girl got the nerve to go talk to the counselor, and about a day or it was the week after, because I went in once a week there. A week after she came up, and she said, "Hey, Mr. Ryan, I really appreciate you telling me to. I feel like this whole time my dad was using, that I knew he was going to die, but I didn't know how, I didn't know when. But it was super helpful to talk to someone that had understanding on this stuff, and I appreciate it. And I know it won't bring him back, but I know that I feel like there's a burden off my shoulders." I'd never experienced anything like that up until that moment. And I'm not, and I tell every kid, I'm not a counselor. I just teach this class, and some things will help, some things may not be for you, but if you can help someone else with them, then great. That was something that was a takeaway for me, where I just started kind of listening closer and closer to these sessions. Hope that helps.
Thank you, Ben. Yes, that's very helpful. And we're glad to know that, it's really impacting the work that you do. Thank you for sharing. Anyone else like to share?
Hello, Cindy. This is Diane.
Hi, Diane.
I'm calling from Yankton, South Dakota, and during the summer, I work with the different reservations that we have here in South Dakota, Nebraska, and Iowa, and I work with some undergraduate students, and we do community-based participatory research that's basically on interventions. And with this, it just really, even during COVID, how important interventions are. And so from my experience from interacting with Great Plains Action Society that spoke here about the missing, murdered Indigenous women, I reached out to the leader, the chair, and just said, I had some ideas about what an intervention might look versus just, what can we do with the communities to educate. And from that meeting that was in March, that when she spoke, and then even through that by July, we had an event that because of COVID had to be somewhere that where it usually wasn't, had to be canceled because of the shutdown and everything. And we actually were able to do an event where in an urban, in like Sioux City, Iowa, that doesn't has many different tribal members, and had an event to connect in a safe way, but also bringing youth together and educating about traditional games and activities and understanding what those were in their own cultures, and what I would say was, what I identified was from an area that might be one area of a population of reservation, where a city might have many urban. And what we were finding socially in social media was when we were connecting last year, that all the city people were connecting to the reservations when we were doing things remotely. And so we reached out to those members in the city and brought them together and helped educate about traditions and how important they were. And what I learned was a lot of youth had never heard or seen, but it really felt very important to learn about their culture and everything. And part of my research was working with identifying our traditional games as healthy as what we are when I'm doing diabetic prevention. And from my research this summer, they were definitely, we had the youth wear monitors, and it was, and the traditional games are led by leaders that teach it, and they were all very involved in that decision making. But even as we bring it out, it was very vigorous and everything, and that's why we should promote the traditional games that we can in our cultures. The other part was identifying that the youth, many knew about the different organizations within their families, but when we went to remote areas on different reservations, a lot were not familiar about terms, and we were asking youth and families and everything. So I think it's that importance of collaborating and working together and realizing how important interventions are to bring good from those, to make a change. And thank you for your time.
Thank you so much, Diane. Oh, gosh, those sound like very interesting and innovative ways of reaching out to youth, getting them to learn about, their culture and the ways of life that teach them values. So thank you so much for sharing. I feel like maybe, you could send us some of the resources that you use, and I'm sure others would love to use that for the work that they do. So thank you for sharing, Diane. I'd like to call on Dr. Foster, if he has something to share. Dan?
Almatakipi, Dan Foster, Manchapelo. Nahayu Chante Washtea Pichwakilo. Good morning, relatives. I want to greet you, Mary Louise, my sister's on, and thank you for coming up during Heartbeat Powwow. It was so good to see you and share space with you and have other friends and relatives on this call. I wanted to respond a bit to Ben of some differences, and when we use the word culture, as the speakers have just mentioned. For one thing, we talk usually about we and rather than me. We have a different concept of original sin, though don't misunderstand. I've watched in my 70 plus years, I've watched the Christian influence among us modify how we look at life. And it went from positive, negative to good and bad. It was not good and bad when I was a child. It's good and bad now, which to me is a Christianized idea. Also, when we talk about we're not just talking about the living. We're talking about the ones that came before us and the ones who aren't here yet, the ones yet to be born. They're part of the we. We're not always just talking about those that live, but also what could have been in this life. Something that modern psychology seems to leave out so much is the aspirations of the individual, of the family, of the people, of the community. And those belief systems greatly impact how we use things. And a final thing I wanted to touch on was about the energy. When we talked, for example, a sauna versus a sweat, when our sister was just now talking about games in Yankton, the games, the ceremonies, so much of what we did that we did together, we were passing on culture. But culture was more than just culture. Culture was a way of coping. Culture was a way of networking, a way of perceiving, a way of understanding, a way of responding. And we're still burying people that have been vaccinated twice. And the part of me that goes into conspiracy wormholes wonders if some of the folks in the refrigeration change with the Pfizer vaccine with Indian Health Service sabotaged it, because this seemed to be an opportunity. We just started live school here in Montana, and my two youngest are both on suspension for punching kids that are calling them black monkeys and prairie niggers and so forth, which really escalated during the last administration and has become horrifying. And there's many non-Indian people that are very loving, great neighbors, fellow Montanans. But my mom used to say when I was young, when people would say hateful things, she'd say, there's good white people, Dan, they're just quiet like us. I'm not trying to make anybody self-conscious, but the color issue, colorism is very much an issue, just as genderism, just as poverty, status are very much issues in the United States. My Christian relatives believe in a kingdom of God. Kingdom didn't work too good with my white relatives. They fled kingdoms to get away from kingdoms. They had revolutions because human beings didn't live well under kingdoms. And we don't live well under our culture is very much participatory. It very much inclusive. It includes old and young. It includes rich and poor. The values matter. And so the biggest difference for me between a sweat and a sauna, because both are cultural aspects of life. And my white relatives often don't see white culture, but any of our kids that leave the reservation quickly feel like fish out of water. They recognize the difference between dominant culture and our local tribal cultures, even if they don't think they have culture because they don't speak the language or know the songs. And so the point that I want to emphasize is that the element of energy. And we move and share energy. Sean shared it with his song this morning. Songs are a way of bringing energy. So is the drum, so are the rattles, so are the way that we sing and our rhythm and pattern and pace and our communal sounds. Those are all elements of energy, and that is very much a part of our Inipi, our Stone Person's Lodge ceremony. And sometimes we're careful how much we say because people will romanticize. There's none of us that are any closer to the earth than anybody else. Gravity holds us equally. And for us, love, our love of Creator, our love of creation, our love of one another, our love of ourself, our love of life, in all of its presentations, is the gravity of our soul. It's what connects us to life. Our love of our family, our love of our culture, of our language, of our history, of our future. That's the gravities of our soul. And so that energy that each of us brings, and when we say Mataku Ye Oyasin, we literally mean that on an energy level, everything is connected, everything is related. Now, I don't think those beliefs are anti-Christian or anti-Muslim, depending on where you are in the belief spectrum, but they are fairly common among the many tribes that I've had the opportunity to learn from and to be taught by and to share with in both ceremony and in conversation and just in life. And so that one of the things that surprised me when I became a psychologist was that I could be a psychologist just by answering paper and pencil tests. In our way, if you're the first one, if you're the midwife to breathe the first breath in a baby, your character is really important. How you've lived your life really matters. The character of that breath of life that goes into that child to us is going to have an effect on the foundation of this life here on this earth. And it's not a sin and saint issue. It is a positive and negative issue. It's important not just that you aspire to a positive life, but it's important that you've lived a positive life if we're going to trust the birth of a new child to you as the midwife. I bring that up because I could be a psychologist and no one would even know my character. We wouldn't let you pour the water in the sweat unless we knew your character. And it's not that we do see progressive, and we do have folks that go through really hard times and with addictions and compulsive behaviors that are unhealthy for the people. And like the story that was passed about Ivy, we see the outcomes, and the negative and positive outcomes are wonderful teachers. Pain is a very honest teacher. Yet we live in a society where we try to give medications and strategies to have a life without pain. Good luck. Pain is an essential part of life. Pain is an essential part of learning. To accept pain does not mean you approve of it, doesn't mean you like it, but it means that you can bear it, you can live with it. Some of our ceremonies are quite painful. They teach discipline, they teach inspiration, they teach perseverance. So many of our games also are of that nature. So our games weren't just games, our games were preparation for life and practice for future. It was helping us build a skill set that would help us live with threat and pain and harm, even though that doesn't define us. Our hope defines us, our love defines us, our joy defines us, our gratitude defines us. In working with substance use disorders, my best prediction, if I look back over my 50 years of work, is how much gratitude do people have? The people that have the most gratitude, I find they get traction in sobriety and are able to sustain it. And I encourage sobriety not because it's sinful to be addicted. I encourage sobriety because it kills us, it destroys us, it makes us all equally stupid. In a way, that's a good thing. I mean, it's nice that none of us thinks they're above anybody else. That's a good thing. But we don't think very well when our minds are affected and impacted. And spirit can't talk to us and through us the way spirit does and can. I'm back to energy because spirit, we are energy in a physical manner. Our belief is that we are spiritual beings already, and we come into this life not to create the experience of a spiritual being, we are already that, but to create the experience of a physical being, of that which spirit is not. To us, there can be no eternal life without physical death. There can be no joy without sorrow. There can be no wisdom without ignorance. And in this life, we're going to create the experience of all those things we are not, a spirit. We're going to create the experience of aloneness when we're part of everything it is, ever was, and ever will be. We're going to create the experience of despair, of ignorance, of stupidity, of sin. All of those are contrary to our spiritual nature, but essential to have that experience. So I'm just sharing these few ideas because I don't hear them shared very much. I found through my years in school and stuff, my schoolmates knew more about Baha'i faith or Buddhism than they did about American Indian understandings. And we were at boarding school, our relative Darren spoke of boarding school. I'm hoping you're not talking Shalako, but everybody went to Shalako, it seemed like. But the boarding school experience, they didn't even ask us what we believed. They didn't even ask us to speak our language. They didn't even ask us to share our songs. I always thought we had beautiful beliefs, and I still think that. Well, thank you, Cindy, for letting me share a bit. Thank you, relatives, for listening. If I offended, I meant no offense, but my intention was to speak on our behalf as Indigenous to this land. I say these things that the people will live. Thank you.
Thank you so much, Dr. Foster. A lot of wisdom in that, made me think about, my life, where I've come from, where I hope to go to, and how I hope to carry the values from my own indigenous peoples with me long term, and hope my children can also, I can pass that on to them. So thank you so much for sharing. I'm sure a lot of people got a lot from that. I see Sean also put a summary in the chat box of some of the things that he also got from that. So thank you, Dr. Foster. Always great to hear from you and your wise words.
Excuse me, Cindy.
Yes, please.
May I please just let Dr. Foster know that I humbly appreciate what he just explained. And I guess from start to finish, when he started and finished, I don't know how anyone could not get something from that and grow internally. And I just wanted to thank him. Appreciate it.
Thank you, Ben. Thank you, Dr. Foster. That was beautiful. So yes, I don't know if anybody has something to share yet, but I wanted to pass on to Jason Butler to share some of the success stories from the work that he's been doing the past year during the pandemic. Any resources he would love to share with us? We'd love to hear that. Thank you, Jason.
Yeah, no problem. Thanks for asking, and it's good to be amongst you guys today. It's been quite a while since I've been able to log on to anything like this. I've been fairly busy for the last several months, so I presented on some of these and then logged on to some of the listening sessions, and I always found them very helpful. So this one popped up on my calendar today, and I got a free day, so I said I'm going to log on, and then I got put on the spot. So, but yeah, my name is Jason Butler, and I am a member of the Ute tribe from Fort Duchesne, Utah. But I currently work for the Shoshone-Bannock tribes here in Fort Hall, Idaho, where I've made my home for about the last 20 years. And I work for the Tribal Health and Human Services. I was the Recovery Service Coordinator for the Four Directions Treatment Center for a little over 3 years. So what I was doing over there is I kind of was given the task of building a peer recovery support program. When I got there, it was kind of in place, but they weren't really doing much. So, you know, I was kind of the guy that came in and was tasked with putting it all together and turning it into something awesome. So, you know, it was I found it to be a really good program, recovery coaching. It allowed us to think outside of the box and really do a lot of different things that typically a treatment center would not be able to do, just really based on a lot of the ethical guidelines that counselors have to abide by. Whereas with recovery coaches, being members of the community and people that are in recovery, they're able to share a little bit more, build a little bit more of a connection. So really, I think where it started with was trying to really sit down and figure out where some of our gaps in service were, you know, within the program. So just gathering information from the recovery coaches, gathering information from the community, and then also from clinical staff, you know, asking the counselors what are things that you wish you could do, but you really can't do, you know, and gathering some of those ideas and saying, you know what, I think we can do that. So really acting as an extended arm of clinical services is what we were doing. So it allowed us to think outside of the box, and we really got going with a lot of different activities, infused a lot of culture into what we were doing at the treatment center. So I heard someone mention culture earlier, doing things that people normally wouldn't do in a treatment setting, like learning how to brain tan deer hides and learning how to fillet and smoke salmon and different things like that. Teaching the women how to make wing dresses for sweat. You know, all kinds of different things, and then doing activities and adding classes and, you know, all sorts of things. But when the pandemic came, it really put a halt to almost everything that we were doing because we could no longer have contact with people face to face. So the tribe shut down. We got sent home for about a week. Well, longer than that, it was 2 months. But after a week, we started getting calls from clients and patients, and people were really struggling. We had some relapses. We had people that were struggling and about to relapse. So we really had to figure out what we were going to do. And we were able to put a lot of our services online. So we used Zoom, and we were able to put a lot of life skills classes on there. We moved our support meetings online. And then with the Sweat Lodge, you guys mentioned sweat. We did have a Sweat Lodge there. They have it now. It was every Wednesday at 5 o'clock. So we weren't able to do that. So we just tried to figure out, I guess, again, using that mentality of thinking outside of the box, but also taking on the mentality of recovery when we really think about what is recovery. It's the process of growth. It's the process of overcoming adversity and getting around barriers, So the way we took the pandemic was just, this is recovery. All we're doing is just another step in the process of recovery and using that to try to get services out to people. So we did things like, in place of this Sweat Lodge, we started holding a virtual community prayer. And that's still going on today. So that happens every Wednesday. I think they moved it to Tuesday at 4 o'clock. And we were getting quite a few people logged on. What we were able to do with that was really quadruple and sometimes multiply that by quintuple the amount of people that we were serving, because we removed the barrier of people that didn't have rides to make it to the treatment center, people that couldn't find childcare, people that were working while the classes were going on. People could log on from anywhere. And it was only not limited to just people in this community. So we had people all over the country logging on from different Native communities and different treatment centers. So things like that, just thinking outside of the box. I think, I think that's how that whole program came about, was just figuring out how we can offer more services. So I think the message in all of that, that's kind of the short version of what we did over the course of the last year and a half. But, it was just taking on that mentality of recovery. One of the things that we did once we were able to kind of have like super limited face-to-face contact is that, because we had thought outside of the box before, we built a recovery garden in the back of the treatment center. So we had this huge garden with 20 garden boxes back there. It allowed me to contact clients and say, hey, why don't you just come over and garden? Even if you don't want to, it's a place where you can come. We can sit there and we can meet face to face and keep a 6-foot distance and wear masks and be outside. So like, just from thinking outside of the box previously, it allowed us to kind of move forward with face-to-face contact before really anybody else ever was, because we had created an area that would allow us to do that during the pandemic. So I think that's my message, is just as you move forward in trying to build new things, try to think of things that aren't typically being done and think outside of the box, because it really becomes helpful when we're trying to reach more people and connect more people, bring people in that normally wouldn't do that. There's different opportunities. If you're doing cultural activities or if you're doing gardening, that's an opportunity to pull people in where it's not a typical come in and fill out this paperwork and see your counselor. We're able to say, we're not just doing that. You can do all of these other things, because that growth and that overall holistic view of health is really what recovery is. And sometimes we kind of put blinders on and we think that it has to be AA meetings and clinical treatment and different things like that. But when you tie culture in and you start pulling in all these different things, you realize that really recovery is just a process of growth. So, that's kind of the short version. If you want information, I don't work for the Four Directions Treatment Center anymore. I moved within Tribal Health. I'm now the CHR manager. But if you're on Facebook, you can go to the Shoshone-Bannock Tribes Facebook page. You can go to the Shoshanese's Facebook page. And I believe Shoshone-Bannock Tribal Health and Human Services. And they post those flyers every week. So There's life skills classes on Monday and Tuesday. There's support meetings every day at noon, and there's a prayer on Tuesday, and those are every week. And they've been doing that. We started that, I think, in March when the pandemic very first hit, and it's been going strong since. So if you want to look that up, you're welcome to. And like I said, they post those every week. If not, I think you're welcome to probably call the Four Directions Treatment Center, and I can put that number in there. And like I said, those services are open because it's on Zoom, so it's open to anybody. I was sending those things all over the country, and we were getting people from all kinds of different reservations and urban communities logging on. So just a good opportunity to, just for people in recovery to connect to something outside of what they're used to, which is also good for growth.
Thank you so much for sharing, Jason. Like others are saying, great information. It shows a lot of growth, and we're so grateful that you shared these adaptations you've made to your programs has helped you and everyone working there, and also those who receive the services to still get access to these services. So thank you so much. We're getting close to the top of the hour, but we have a very important question in the chat box that I wanted to read out. So Veronica was asking, what is everyone doing for our relatives who do not have computers or internet access? How are you engaging them in your programming during this pandemic? And I don't know if there's anyone here who would like to share about how they're engaging folks, especially, some of our elders who don't have computers or internet access. Is there anyone doing programs that's helping reach out to those people? Please, we'd love to hear you share. Thank you. I don't know if anyone would like to share. Before anyone does, I do remember, I'm trying to remember the community exactly, but at the beginning of the pandemic, you worked with youth in the community to reach out to the elderly and those who were not able to have internet access, or those who weren't, the programs couldn't reach by phone or internet. And so they got the youth to sometimes take food or, help them deliver their medication at their doorstep. Also had flyers to help them know about information that was going on in the community, whether it was about updates on the pandemic or it was about programs that they could reach out to directly if they needed help. Some were also had an active list of members of the community, of elders or people with disabilities, and took active measures to reach out to them, whether it was weekly or bi-weekly, just to check in on them to see how they were doing during that time. So those were some of the things I remember that people had shared previously on reaching out to those who didn't have computers or internet access. I also remember, but I'm not sure what source of funding that was, but some people had also mentioned a source of funding that could help support people like seniors with, cheaper internet so that they could easily be reached out to. So yes, I think that's some of what I learned the last time when a similar question came up. But we have some ideas in the chat box. Melanie says, in order to reach our elders, they made a point to visit the Elder Center with flyers, talking in person about their programs. They also have a tribal newsletter that goes out monthly with updates. Emily says they opened up community centers for remote learning for students to have internet access for those living on colony. Schools also eventually provided hotspots for students to take home. That was great. So through schools and through community centers. And Twice says they manage an apartment complex and host 3 elders, limited number because of the pandemic. And they practice all the traditional ways of preserving their food, integrating the language, and talk about history, and give food to families in need for funerals and traditional events. Thank you. It's a lot of great ways to connect. All right, so we are past the top of the hour. We want to thank you so much for joining us. We've really enjoyed the time with everyone. Thank you for sharing your time. Thank you for visiting with us, sharing your resources, your knowledge. I always learn something from these sessions, and I really appreciate everyone who's able to share with us. So thank you all for joining us. Our GIPRA link was put in the chat box, but it'll also be in the follow-up email. The follow-up email would also have information on how to request for CEU certificates. So thank you so much for spending your time with us. We hope we'll see you soon on our future sessions. Like we said, for this listening session, this is the last one for the year, but please look out for information for the New Year's and 2020 sessions for 2022. We look forward to seeing you all. Thank you for your time. Have a great weekend.
Thank you, Cindy.
Thank you.
Have a good weekend.
Thank you. Same to you.
Thank you, Cindy.
Thank you, Dr. Foster, too. Appreciate it.
Blessings, Dr. Foster. Everyone.
Have a great weekend, everyone.
Be well.
You. And we'll put out some of these resources in the follow-up email, just so those who are not able to copy it from the chat box can also have it as a resource to refer to. The phone numbers, emails, and information on how to reach out to those without internets and computers. Thank you.
Thank you, Cindy, Sean. Blessings.
Thank you, Dr. Foster. Always a pleasure.
Thank you, Cindy. Bye.
Bye. Thank you.
Thank you.